Hello students, welcome to BluepenOnline classes. Here we have Dr. Harshida and Dr. Anu to take classes on local anesthesia.
And so today's topic will be local anesthesia. So anybody of you know something about local anesthesia? Okay, so now we have Dr. Anu here who will just tell us in brief about the local anesthesia. So let's get started.
So local anesthesia in its simplest definition involves numbing of an area of the body using a type of medicine which is known as local anesthetic. So basically we have a loss of sensation in that particular area of the body. So to define local anesthesia, it's just a loss of sensation in a circumscribed area of the body which is caused by a depression of excitation in nerve endings or an inhibition of conduction process in peripheral nerves. This is how we define local anesthesia. And the very important point is that it is transient. Transient means what? It is only lasting for a short time and a very completely reversible state. Now, when it comes to the properties of local anesthetic, the first and the most important point is that it should not cause any irritation to the tissues. There should be no irritation at all, right? So there should not be any kind of allergic reactions also resulting from this. There should be no permanent alterations in the nerve as we enter that area directly with the needle, right? So there should not be any kind of permanent alterations. The systemic toxicity, that should be really low. It should be effective, of course it should be effective. And the time of onset should be short. I have the next slide. The duration, it should be long, but we don't want an extended recovery. It should be long only for the procedure to take place. Now the potency, it should be sufficient and you should not use any kind of harmful concentrated solutions there. There should not be any allergic reactions at all in the first point. It should be stable. It shouldn't readily undergo biotransformation when it enters the body. It should be either sterile or it should be capable of being sterilized by heat without any kind of deterioration. So this is a brief introduction to the topic of local anesthesia. Now, Dr. Harshida, what happens in electrophysiology of nerve conduction?
Okay, so basically electrophysiology is nothing but what actually happens when a stimulus comes and hits the nerve. So to be more precise in it, basically a resting nerve, it will always have negative potential of minus 70 millivolts. And what happens in nerve is the inferior of the nerve is usually negative compared to that of the exterior of the nerve. So when suppose a stimulus comes and strikes your nerve, there will be a following series of events which will be going on. So the first one is the depolarization. Then it will be again there will be a rapid phase of depolarization and you will see the reversal of potential and then there will be repolarization. To be more brief into it, so initially what happens when a particular stimulus comes and hits your nerve, there will be an initial phase. So in initial phase what basically happens, the negative potential in the nerve, which is minus 70 millivolts, will be slightly more negative compared to the earlier. So it will be somewhere around minus 50 to minus 40 millivolts. Then after that, there will be a critical phase where the negativity will still go down and down. And after that, there will be immediate reversal of the charge. So what happens in the rapid phase, when the negative goes to minus 40 millivolts, due to this reversal, it will become plus 40 millivolts. So it will be positive in the inferior compared to that of the exterior of the nerve cell. Then after that, we'll have something called as repolarization. So in this repolarization, what happens? Again, whatever the stimulus is hit the nerve will be taken back, and then the potential in the inferior of the nerve again comes back to its original state of minus 70 millivolts. So this is basically the electrophysiology of what happens within the nerve when a stimulus hits. So now to continue with Dr. Anu, can you please start off with the electrochemistry of the nerve conduction?
Now we will see the same sequelae in its electrochemistry part. So actually in the sequence of events, it actually depends on two factors. One is the concentration of the electrolytes. You have to compare it with the interior of the cell and the extracellular fluid. And the second thing is the permeability of the nerve membrane to two ions, sodium and potassium. Now, when it comes to the resting state of a nerve, as you can see in the next slide, can I have the next slide please? In the next slide, in the first picture, as you can see, that is a resting potential. Normally, we are having within minus 70 MV. This is a resting potential and this is a resting state of a nerve. Now, when we have an excitation, suppose we have a membrane excitation there, the first thing that happens is a depolarization. Now, as we know, inside of our nerve is always rich with potassium ion, and the sodium permeability is very less or like negligible there. But when there is an excitation of the membrane of your nerve, what happens is the permeability of the cell membrane to the sodium ion increases. It starts increasing. So that lots of sodium starts to get inside the nerve cell. That's the first thing that happens there. Now the sodium will get inside. Now what happens is we'll have this depolarization happening. So it was minus 70 MV, now it comes to minus 60, now it comes to minus 50, and when it reaches minus 50 MV, it's not a firing threshold. So it's like from minus 70, it reaches minus 60, then now it's minus 50, and now we have something which is known as firing threshold. Now when it reaches this firing threshold, now it's like from minus 50 MV, we can see a sudden rise to plus 40 MV. So this is what happens in the depolarization. So now what happens? The sodium is inside the cell. In the resting state, we don't have any sodium inside because we only have potassium inside, and there is no permeability for the sodium there. But now, after excitation, this is what happens. We have sodium inside, and most of the potassium is outside the cell. Now, after this depolarization, now there is another process which is known as repolarization, because the nerve wants to go back to its original resting state. Now it's excited, it wants to go back to its resting state. That's known as repolarization. Now here what happens is, now we are having sodium ions, right? Because of the depolarization process, we only have sodium ions here. Now we want to push all the sodium ions out of the cell. That's what happens in repolarization process. So the sodium moves outside and the potassium starts to get inside. Here the permeability to the potassium ion increases so that we have efflux of potassium, and this leads to rapid repolarization, and this results in the earlier resting potential. Now we have our nerve in its earlier resting potential. So this is what happens in the electrochemistry of the nerve conduction. Now let's move to the next topic. Dr. Harshada, can I have a note on what are the pain theories and what's the sequelae towards the conduction blockade?
Okay, so coming to the pain theories, we have 5 important pain theories. The first one is the acetylcholine theory. Second is the calcium displacement theory. Third is the surface charge theory. Fourth is the membrane expansion theory. And fifth is specific receptor theory. So out of these 5 theories, the most accepted and the most one which is implemented right now is the specific receptor theory. So the basic concept, what happens in the specific receptor theory, is that when a local anesthesia is being injected into your body, they'll have certain amount of molecules present in them. So what happens, there'll be specific receptor sites present on the sodium channel in the nerve fiber. So this local anesthetic molecules go and bind to the receptor channels, and that is how they start acting on it. So then coming with the sequel of what happens in the action of LA, we have 8 important steps. To start off with, first thing is the calcium ions, displacement of the calcium ions from the sodium channel receptor site. So once these calcium ions are displaced from the sodium channel receptor site, now the receptor site is empty. So the second process, what happens is, once the local anesthesia is injected, there will be molecules which will be secreted from the local anesthetic solution. So these molecules go and bind to the empty receptor sites present on the sodium channel. So now what happens, the third step is they will block the sodium channels. So once the sodium channels is blocked, there will be decrease in the sodium conductance. As Dr. Anu already told that influx of sodium and efflux of potassium causes depolarization of the positive membrane. So when there is no influx of sodium happening into the nerve fiber, there will be depression of the electric depolarization. So once the depolarization is not happening, there won't be chance of reaching the firing threshold level. As she already told you that there's something called as firing threshold level, that is plus 40. So once we don't achieve that threshold potential, then there won't be any sort of propagation of the action potentials, and that is why the conduction is blocked. That is how we have an anesthetic effect produced in that specific area where the anesthesia is given. So this is the complete sequel of how it acts. Okay, so clear about it?